Hi, my name is Suhan Kacholia, and I attend the University of Georgia studying artificial intelligence. This summer, I had the opportunity to work for the Department of Health and Human Services in the Office of the Chief AI Officer, with Sanya Basrik as my supervisor. This summer, I analyzed, visualized, and described the HHS Artificial Intelligence Use Case Inventory. So for some context, federal government is using AI more than ever. In HHS alone, there were 163 projects involving AI just this year. Federal departments like HHS are required to maintain and publicly upload a list of these projects to their websites. And we wanted to understand and analyze this list so we can guide future HHS AI strategy. The data I used involved two spreadsheets. The first was the 2022 use case inventory, which had 52 projects, and the second was this year's use case inventory with 163 projects. The datasets weren't consistent with columns and answer requirements, which made comparing them a bit difficult, but I will show you how I got around that. And some of the columns, just to give you an idea of these datasets, include the name of the project, the agency the project originated in, the description of the project, which AI techniques were used, the stage of the project, and whether or not the agency had data or code access to that project. So what I did to analyze these projects involved two steps. The first was exploratory data analysis, which involved making graphs and simple summary statistics to understand the data. And the second involved a technique called word embeddings, which I used for k-means clustering, and I will describe all of that later. So the first graph I wanted to show is a summary of the projects by each office. For some context on this, HHS is a very federated department, which means that there are a lot of sub-agencies and administrations that compose HHS. Some of these might be well known, for example, the National Institutes of Health, the Centers for Disease Control and Prevention, the Center for Medicaid and Medicare Services, and the FDA. Some of them, however, you might not know, but are still very important to this country and HHS's mission. For example, the Administration for Strategic Preparedness and Response, the Office of Inspector General, the Agency for Healthcare Research and Quality, the Administration for Children and Families, and so on. And this graph shows how much each office contributed to that year's number of AI projects. So the percentages you see are for the respective year alone. So NIH, for example, had around 20 something projects in 2022, which were 44% of the total amount of projects that year. And they nearly doubled this year in terms of the absolute number of projects, but they compose around 30% of the total projects this year. So there was actually a decrease in the overall percentage this year. And that's because other agencies, for example, FDA, ASPR, had huge increases in their AI projects. FDA went from only having like 6% of the total projects last year to around 30%. And ASPR went from none reported last year to almost like the third most number of projects. You can see also that some decrease. This might be because of different like reporting guidelines. I know that some of them, for example, had multiple projects that might have been consolidated into like just one entry this year. So some of it is like quirks of reporting, but overall, this should give you a good picture of which offices are contributing the most projects to the overall spreadsheet. The next graph I wanted to show shows the techniques by each office. So this is only for 2022. 2023 was a little bit harder to analyze, but I'll describe that in a second. And this just shows what actual techniques were used in each project for that year. So some of the most common techniques include neural networks with like 8 projects, search and optimization algorithms with 11, and natural language processing with 6. And as you can see, it's very diverse with respect to which techniques each office used. Some of them relied heavily on one or two techniques like AHRQ, which a lot of their projects were focused on search and optimization, whereas the CMS used a wider variety of techniques, including like chatbots, clustering methods, etc. Um, but yeah, this should give you an idea of like when we talk about AI, what is actually being used in these projects. And then for this year, the techniques column was more open-ended, which means that people could put anything from like one word to paragraph long descriptions of the AI techniques used, which made it a little bit harder to compare year over year. So instead of trying to do that, I decided to just make a word cloud, which should just give you a more qualitative understanding of the kind of projects that we're doing this year. So again, you can see natural language processing shows up a lot, machine learning search shows up a lot, deep learning, neural networks, and also like smaller ones that are still significant include clustering, modeling, classification. So this should give just like a high level overview of what kind of AI projects we did this year. The next graph is the developer of AI by office. So this refers to whether it was outsourced to like a third party or contracted, or it was developed in-house. Neither of these options are necessarily like better or worse than the other. You wouldn't want to spend significant resources on something that can be done more efficiently or cheaper by an outside party. And similarly, you don't want to outsource everything. It is sometimes nice to have in-house capacity, or there might be use cases that are more internal to the department. And here you can see that for some agencies or offices like NIH, FDA, CDC, there are a lot of in-house projects, um, and also like a mix of contracted projects. Whereas for other agencies, the other ones on this list, it's almost all contracted. The next thing I wanted to talk about was embeddings. So embeddings, or like word to vec, is a technique to convert a word to like a numerical representation of that word. And using that, you can describe different sorts of relationships to other words using those numbers. So for example, like man to woman as a vector would be parallel to king and queen, representing some sort of like representation of the concept of gender as a numerical value. And one other thing you can do using this, if you have all your words as numerical vectors, is do a clustering analysis. So this involves, putting all of these vectors in like the same space as one another and seeing which are just closer to each other. So schools, elementary, college might be like one cluster, whereas ball, kick, and throw might be another cluster, just representing different like spaces of concepts. In this case, one is more like education focused, while the other is more like sports focused. And I basically did this for all of the AI projects that we had and put them into different clusters. And then I labeled these clusters, and just to give you like an idea of like what type of project each cluster contained. Here you can see like the graph of how all of these projects fit together. One thing to note is that the axes don't really like mean anything. Like you can't just say that the x-axis represents something that like we can understand. It's really just like a way of kind of putting all of these vectors in like a two-dimensional space. So it's just really like a tool to like visualize them rather than meaning anything real. But with that being said, the four clusters that I found were the first was information management. So these were projects that were kind of focusing on indexing and managing grants. The NIH has a lot of grants. They wanted to use AI to manage some of them and maybe connect them to like researchers, or like information processing, putting documents into different buckets. So that kind of thing. The next was more direct like biology research. So maybe you were trying to predict like how a certain drug might cause adverse events in individuals, or do like community health indicators using AI. So these are more just like direct public health research or like studying drugs or that kind of thing. The next involved chatbots and natural language processing. So, for example, the Centers for Medicare Services made a chatbot on their website to better understand their programs, or these projects might involve natural language processing or have a public interface. And then the last cluster I found was detection and devices. So these were projects that were more like hardware focused. One notable project here might be the CDC's project to detect COVID just from coughing into smartphones, or other like handheld devices to diagnose various diseases. So these are more just like actual physical devices that you could use for oftentimes diagnosis, but also other uses. So that is a main summary of the main project I worked on this summer. After this, I also worked with Keith Boshin, who's in the OIG office, and we basically extended this clustering analysis and made it a little bit more complex. And we did that across all federal government AI projects from other departments too. So we tried to find these big clusters that could apply to like projects across the whole government. And that's very useful because we can use those clusters to connect people who are doing similar things with each other across government, and hopefully have them share resources and like make sure we're not duplicating efforts across government with regard to AI. And the Responsible AI Officials Council might actually use this analysis to connect these project clusters later in the fall. And within HHS, this analysis will be used to guide future investment, training, and support for AI initiatives in the department. So with that being said, I wanted to say thank you. Thank you to my family. Thank you to Sonia and Greg in the OCAIO office, who were my main supervisors. And thank you for coding it forward, and all of the team for making this really amazing experience possible. But yeah, thank you so much, and thank you for listening.
And
Yeah.
oh, sorry, Remy, please go ahead.
Just curious what tools or projects or open source libraries you used for the natural language processing and clustering.
Yeah, I use this model or this like library in Python called sentence transformers, which allows you to convert any words to like an embedding. And specifically, I used a model called all minimum like V7. I think it was like a 7 billion parameter model for embeddings.
Yeah, hi, thanks. I'm wondering, I'm assuming there's probably a higher level of sophistication at the federal level, but I'm wondering if you had to do any like education on like what constitutes AI and what constitutes something that you care about and want in the inventory versus like, a linear regression or like something we wouldn't quite care about for these purposes.
Yeah.
didn't actually like make the I didn't actually make the inventory myself. That was more like my supervisor reaching out to different offices to like ask for their AI uses. But you're totally right in that like there's a large variety of like what is considered AI. Like to some people, like a regression model is like AI, and others might just consider like more advanced stuff AI. Um, and also just like coordinating data across different offices is a big challenge that I ran into. Like different offices reported their data like very differently, and so trying to like standardize that was definitely a challenge. But yeah, I wasn't the one who actually like made the inventory. I was just analyzing it mostly. Charles has his hand up.
I think Anna had her hand up before me.
Oh,
Go
okay.
ahead.
Anna.
Oh, thanks. So I wondered if you in working with these sort of mapped terms, if you ran into any issues of, or is it understandable if you ran into any issues of the terms being used in such a way that they are incredibly diverse from each other and you couldn't, it wasn't accurate to kind of cluster them. So this is a problem that's really mostly a question about large language models, I guess.
Yeah.
where the intention of the word usage does not match across the instances of that term being used in the sample. How do you correct for that, or did you run into that issue?
Yeah, that's a really good point. The descriptions that they had were pretty like long, and because of that, I thought that like it wouldn't be that much of a problem because there's so many words that like you are relying upon to do that clustering. Like maybe if you had something like AI in like one context and another, like you might not be able to tell like just from that alone like what they mean. But because the descriptions I was using were like paragraphs of like, oh, we use natural language processing to like classify grants and use this algorithm specifically, blah blah blah. I thought that that could be avoided just because there's so much more like context available that um yeah, the clustering would work. Also for the like at least the federal government level, what we did was like we made sure that anything from the same like sub office wouldn't be clustered together just because then that would just be capturing like similar offices doing similar things. Yeah. Oh, and okay, we have 10 seconds, but Charles, if you want to quickly.
Oh, it's all right. It's all right. Thank you.
Okay. But yeah, thank you all so much and hope this gave a good picture of what AI is like at HHS.